Welcome back. This Women's Health Wednesday, we're updating you on the lingering maternal health crisis in Arkansas. Today, leaders from Arkansas's 33 delivering hospitals gathered for the Maternal Health Roundtable hosted by the Arkansas Center for Women and Infants Health. I stopped by today and heard from some of those leaders as well as today's honored guest, Senator John Boozman. Take a look at what they had to say.
It's no secret, Arkansas ranks as one of the worst states to have a baby in.
I think for me, I'm looking most forward to just the collaboration. Having 33 birthing hospitals in one space, I think this is unprecedented. It's needed. I think this is what it's going to take to drive the conversation forward and truly address maternal mortality.
And it's no secret that health professionals and politicians alike are on the hunt for permanent solutions. Today is an extension of the urgency-driven bipartisan blueprint to improve Arkansas's maternal health system once and for all.
So the idea that the who's who of all of the state's resources that are working on maternal health this year is so exciting. And so I'm looking forward to just listening to what's going on, what we've done, more importantly, what we're going to do in the future to tackle this very difficult situation, which is very doable.
The Arkansas Maternal Health Roundtable discussion shedding light on the role of doulas, certified nurse midwives, and community health programs. Kalena Jones is the director of community health programs at Baptist Health, where she works every day to find mothers a fitting coverage plan.
Some of the women that we're working with are not familiar with the healthcare system in general. And when you take that issue, you compound that with some other literacy issues and or just accessibility issues, such as internet accessibility or transportation to get to and from an office. It makes a challenging process for a lot of these women. The paper application is pretty lengthy. And then transitioning from a Medicaid plan that supports pregnancy to a traditional plan is not as smooth as we'd like it to be.
Passed in this year's legislative session, the Healthy Moms, Healthy Babies Act made headway in the state Medicaid program, establishing presumptive Medicaid eligibility for pregnant women and Medicaid coverage for remote ultrasounds, remote blood pressure monitoring, and continuous glucose monitoring. But one improvement many health officials still say is needed involves transportation.
Women sometimes have to wait all day to get to and from their appointments. And this is due to limited capacity of the Medicaid transportation services. Another challenge is that women that have older children in the home, those children can't ride on those vehicles. And so mom has to make a decision. Do I go to my appointment or do I leave my kid home alone? Well, it's not quite safe to leave kid alone at home if they're not at a certain age. And so it's definitely room to revisit those policies and find a way to make it a little bit more accessible for some of these women.
Emily McGee, Chief Nursing Officer and Vice President of Women's and Children's Services at St. Bernard's in Jonesboro, says people are traveling as far as an hour and a half to get to their delivering hospital.
We see that, we have patients that come to the clinic on the Medicaid van and they're at the clinic all day because the Medicaid van can't come back to get them. So that's definitely one piece that I would like to explore further.
Healthcare officials have been praising the Healthy Moms, Healthy Babies Act since its passing, but many agree there's still more work to be done. Just over half of Arkansas counties are considered maternity care deserts, which makes navigating rural healthcare a challenge. It's something Senator Boozman is addressing on the federal level.
I think the biggest problem that we have in Arkansas and nationally is our rural areas are losing population. 53% of the counties in America lost population in the last census. 53 of our counties, of our 75 counties, lost population in Arkansas. When you do that, you lose resources. You lose federal and state monies coming in. It's just much, much more difficult. Puts a real stress on the system. So we've got to do more to make rural areas more livable. And that involves education, it involves hospitals, all of the things that we need in order for America to prosper.
Well, we'll have more of today's statewide maternal health roundtable over on KATV.com.